I don't know if it's a good thing that things were pushed off or not. But we are going to celebrate today with, what do we call it? Botox and fillers, the good, the bad, and the ugly. And I'm going to turn this over to Karen Lynch, who's going to be our guide today. So Karen, take it away.
So we're going to answer the question, do you look weird after Botox and fillers in today's What's for Lunch? Botox and fillers can reduce wrinkles and give you a more refreshed appearance. But what happens when you feel like you look worse? Today we'll discuss what you need to know to avoid uneven brows, dramatic unnatural results, and frozen faces that may occur from receiving injections from someone who is not experienced in the art of injection. So I'm going to take this over to, or let Karen and Hope discuss some of these photos that you may see and go over some of the good and the bad and the ugly.
So Hope, starting out, what's the biggest worry when you have someone coming in for Botox? What do you hear them say?
I would say number one is the duck lip.
Oh, for
I'd
both.
say number one, people are scared of lip filler when they've never had filler before. They assume that that is a common occurrence when it's really not. A lot of people have fillers and you don't even know. I mean, I have, gosh, probably 7, 8 syringes at this point in time. So, I mean, you don't have to look unnatural. You just have to be placing the filler in the correct areas to get the augmentation or the reduced shadowing that you're going for. So
I would agree. And besides lips, people are really afraid of that really puffy cheek look. And I try to explain to them that that doesn't happen by accident. Somebody's really worked very hard to put that much filler in cheeks. And certainly I have a couple syringes in each cheek at this point. It looks normal. And so we've got some pictures of really what people are trying to avoid.
Okay, so let me go ahead and get your photos up here. And we're going to come in here. Okay, so there's your first photo.
okay. So I chose this one because look at his profile. You can see that he obviously has too much filler in the upper lip, as well as too much projection, too much of that lip going forward. Now I researched him and he looks kind of normal from the front in a photo. I mean, you can still tell there's a little bit too much augmentation there, but really the side is what you're really seeing there with that projection. So when we fill the lips, I've watched Karen's technique, she's watched mine. We both are very similar with how we naturally structure and give you back a little bit of what you've lost, or just give you a little bit of what you want, you know, a little bit of an augmentation with it still looking natural and not projected. So when you shape the lip, you want to make sure that you're shaping it in a way that the lip will not project outward. You want it to rest flat backwards and at the same time turn up the vermilion, that red part of the lip that it seems like he was really going for without it looking unnatural. So sometimes we'll go around the mouth first to help flip that part out to help you see more pink of the lip. If you just direct all the filler in the red part of the lip, you can get an unnatural appearance. So we make sure to go around and do certain little tricks that we have to flip the red part of the lip outward without actually putting too much filler in the lip itself. So that's why I chose that one.
So Hope, let me ask you, so with that photo, and I'll go back to it in a minute, so besides it looking kind of ducky and full, is there like a normal ratio that one uses for the upper, the lower lip balance?
You know, I tend to, in general, you want a fuller lower lip, just a little bit. So as far as an exact ratio, I don't know what you would say, but the lower lip, I do tend to make sure that that's a little bit fuller than the upper. So if your upper looks fuller than the lower, right away you can tell that that's typically an unnatural appearance.
And Hope, some of this definitely depends on the age of the individual.
Yeah.
If you're talking about someone in my age range, we're trying to keep it super natural, not trying to look like the movie stars or media people out there. And then I think that ratio is typically about 1/3 of volume upper lip, 2/3 lower. So that lower lip is usually a little bit fuller with more pout. But younger gals are following the media a little bit more, and they're looking, they really want more of a fuller upper lip. And then the trick is keeping it looking natural and normal while still giving them some of that cushiness and plushness they're looking for.
Great. So, we talked about this, and I'm just going to mention something, even though it's not exactly what we use. That golden ratio, something called, phi is really, I forget what it is. It's like 1.618, right? You'll find it in nature in many different things. And the balance of the upper and lower lip, usually people might use that, as Hope said. The lower lip generally is larger. I'm going to go back to that photo just if I can here and see if I can show you part of the problem here. And sorry about all of this. I don't know where my keynote went. There it is. Oh, that's not the photo. But, well, you know what? I'll find it in a minute here. Sorry about that. Let me check it out. Oh, here it is. Okay.
While he's finding that, the other thing, measurement that we're looking at is tip of your nose to the tip of your chin. So if you're looking from the side and you draw a line or place a pencil from the tip of your nose to the tip of your chin, your upper lip should not project out in front of that line. It's just way out of proportion if you get that full. So it's another guideline that I talk to patients, and that helps them understand what we're trying to find.
Okay, so you guys can see this again now, right? Is it on your screen? Okay. So bunch of problems here, but okay. Any other comments on him? Should we move to the next one?
We can go to the next one. I don't have it on my screen though. You can.
You're not seeing?
I've got the Looking for Beauty golden ratio is on my screen right now.
Ah, well then let me move this over here then. Sorry. Let's try one more time here. Third time's a charm. All right, how's that? Better?
There he is.
No.
All right, there we go. Sorry about that. Okay. All right, let's move to the next one then here.
Okay. Karen, do you want to get started on this one?
Sure. So it was interesting researching. I came across a term they call pillow face, which I think that is this Nikki, someone? I think that she's so beautiful on the left hand side.
I know.
And she has so much volume in her cheeks and her lips that her facial features are distorted. Her eyes are smaller. You look at her and you see cheeks and lips instead of the beautiful contours of eyes, mouth, a beautifully shaped face. And I don't know why this is popular, but it is apparently among movie stars. And yeah, so she has way too much in her cheeks. It actually almost hides her eyes. Her upper lip and her lower lip are overfilled. So
Yeah.
I think it's a shame because she was absolutely beautiful beforehand.
And one thing that we do when we're treating filler is sometimes we'll have you animate. So, when I'm treating out in the zygoma, this area out here to try to get some lift or pull, I'll have you smile and make sure that we're keeping you, because she might look pretty normal or not as filled was she's not smiling. But when you smile, that apple of your cheek gets raised up and you can see that over augmentation a little bit more even. But also her lips, you can tell that she was going for a little bit more of what we call lip show, that red part of the lip showing upward, and that it was trying to be accomplished a little bit too much, I would say, and it gets an unnatural appearance to the lip.
Yeah, if you look, it's even obscuring the show of her teeth. And I mean, she can barely smile and show her teeth now. So
Yeah, she almost looks like she's got a little incision or something, perhaps. I can't, it's hard to tell if it's her lip roll or not. But going back to the cheeks for a second, I think this is one of the things that unfortunately you see way too much of. And I think you see it, I guess we'll call it Hollywood, but where the filler is placed way too far anteriorly, in my opinion, in my aesthetics, where it should be a little bit more laterally, where the malar eminence or the peak of the cheekbone is. I mean, you don't want to create a real wide face, but you don't want the face, who was that actor? I'm terrible with this. She was, I don't know, she was in her 80s, maybe late 80s, a few years ago, and she accepted an award, and you couldn't really recognize her. It was, anyway, this is something that you see a lot of, and I actually have a friend, we were at a meeting, he's a facial plastic surgeon, and we're sitting across from him, and I looked at him, and look at this. I realized, well, she's smiling in both, but her eyes start to look more narrow, right, because her cheek pushing up that lower eyelid, and that's exactly what he looked like, and I'm like, oh my God. I mean, to me, anyway, I don't think that's, and to you guys, I don't think that that's what beauty is. That's not a natural aesthetic. So if that's what she's going for, she achieved it, good for her. But that is a huge mistake that we see patients coming in, where they've had a filler before. So, so anyway, fillers are great in this area, obviously, but this is kind of one of those telltale signs, I guess I would say as well. It just looks unnatural. So she's still a beautiful woman, but all right, let's move to the next one here.
Yeah, and one more thing about that slide. I have a couple of patients who will actually bring in a photo of themselves, when they were 25. And they'll say, oh gosh, look at the apples in my cheeks. And analyzing those pictures compared to this is that, yes, they have fullness in their cheeks, but they also have fullness on the outer portion of their face as well. And so we don't bunch the filler here. It has to be contoured so that you end up with a natural cheek profile. But looking at a picture of someone when they're much younger can be helpful in seeing how they've lost facial volume and where you'd like to restore it.
Mm-hmm. Just while we're on this for a minute, can you guys talk a little bit about asymmetry? I know back in the day when I was injecting, I know that, when I stood, behind somebody, you could really see some asymmetries. Maybe you could just talk a little bit about that in terms of how you're injecting and the communication that you're having with someone about trying to restore, a more symmetric face.
Oh, you go.
I like to describe the symmetry as you want the sides of your face to look like sisters, not like twins. There's a definite way to improve asymmetry with fillers and Botox. When you fix or you improve upon one area, like say someone's cheek is flatter than the other side of their cheek. Well, this really bothers me and I want these to be similar. Well, if I make these exactly the same, something's going to change here. You're going to be a little asymmetric here. So we're not going for perfection. We want you to look more youthful. We want you to look more contoured, but you don't necessarily have to be exactly the same on both sides of the face. So I like to say how that those play together like sisters, not like twins. Karen, do you want to add on to that?
I agree completely. And what's interesting is people often don't see their asymmetry at all until you've put some filler in. And then they see it like crazy and they blame it on me. So I always show them their asymmetry ahead of time. And it's everywhere. The way the brows sit, size of the eyes, under eye, volume, folds, smiles, crooked, chin, jawlines. We're all skewed a little bit. And so I like to show them ahead of time so that they recognize, one, what we're working to even out a bit, but also that this is normal.
Okay. Yeah. All right. I like that sisters, twins thingamajig. It's good. Okay.
I can't remember who I got that from, but I liked it when I heard it too, and now I say it. So this photo is showing you the forehead. I'm not sure if she had Botox or not. Maybe she just naturally has one brow flatter than the other and she can raise this one at a time. But I wanted to show this because there's two muscle groups in the forehead. And there's one that goes across the brow and it's called the glabellar complex and it is what makes us frown. So I don't have any there right now so you can see my frown. So that looks kind of like a V. And it depresses, it pulls down. So when we treat it with Botox, it actually is going to give you a bit of a lift on the brow. So that's important to get the forehead overall appearance looking even. The forehead muscle is a big muscle called the frontalis. It goes all the way across up here. And this is an elevator, and I do have some Botox there, so that mine's not moving much right now, but this is going to rest downward a bit when we treat it. So you want to make sure that you go to someone experienced when you're treating the forehead, because things can go wrong there. And if you stay too inward on one side, this brow is going to jet up in what we call the Spock, right? So that's what it looks like she has on one side. And yet too much Botox on the other side would cause that brow to depress or flatten. So, you know, it may not look too awkward, but when you're talking with someone and you're animating, an off Botox treatment can really make you look a little funny. So we want to make sure that we're getting you treated correctly with a good injector. So Karen, do you agree with the forehead that?
I agree. And, you know, we both see patients who come in and there's quite a bit of difference in where their brow sits before Botox. So sometimes we're trying to adjust or compensate. So in this patient, either her lower brow has a little extra Botox above it, or her upper brow needs a little drop to bring it down. And it's tricky because everybody's forehead is different. I know Hope and I both risk undertreating versus overtreating because we can't reverse the Botox. Once it's in, it has to wear off. And of course, patients don't like it if the brow sits lower. So I always tell patients, hey, I'm going to risk undertreating you. You might lift too much here. It's easy to fix. But if I make you heavy, it has to wear off.
Mm-hmm.
Yeah.
And sometimes people can take 20 units in the forehead and not look heavy. Mm-hmm. And then sometimes, I remember 10 years ago, first injecting, and I did 7 units in someone's forehead, and it dropped, and she was upset. And I mean, it to other people might not have looked that heavy, but to her, I mean, this is your face. This is what you're, you know, looking at people with every day. And ever since then, never dropping a forehead. But yeah, so it's always better to start low and add more.
So let me ask you guys this while we're talking about the forehead. So something that's, I think, a very common challenge with Botox in the forehead is, so many people have these lines and wrinkles over here, right? And they're very close to the brow. So talk to me a little bit about how you manage those lines and some of the communication, you know, what you're worried about and how you achieve that successfully.
Well, first of all, I'll tell patients, look, this crease is because you're lifting your eyebrow. And if you want to lift your eyebrow, I can work very carefully by injecting higher to soften it a little bit. But you're almost picking your poison of a brow that sits higher where you like it, that you can lift, or a heavy brow with no creasing. And one of the things that we can do, and I've done on myself, is actually place a little bit of filler in this area. Because as we age, there may be volume loss. So the bony orbital ridge remains, your skull up in the higher forehead remains, but we lose some cushioning or padding here. So now you actually have a little bit of concavity, and by lifting that out, you can help smooth it. Hope, how about you?
I agree. Yep. You want to stay lighter in dosage over here. And I know, of course, this bothers a lot of people because it's, you know, it raises a lot when you raise your forehead, this area here. And so we can put a touch of Botox and keep it suppressed some, but we're still going to want to have that arch of the brow. We're not going to want your brow to go down and make a heavier eyelid. You're not going to like it. And so putting a little bit of Botox there along with some fillers. There's also a temporal depression, an area here that really makes a big difference with putting some fillers in there. And we have another photo of that too, I think, but putting some filler in the temple does help smooth out that area as well. So I do, as Karen does, we bring it up over the brow as well, but putting in the temple really does help with the eye area in general. Right there, yeah, that one.
Yeah, so I loved this slide because it really does show and emphasizes that temporal depression. And what's interesting is patients don't see it. I don't think I've ever had a patient come in and say, Karen, my temples are sunken, can you help me? What they're worried about is the lines and wrinkles around their lower face. So, you know, she's got her cheeks overfilled, in my opinion. There's too much of a ball. She should have a little more contour going up towards the top of her ear, you know, so that she has a natural cheek, but she's very smooth around her mouth, her lower face, her jaw, but she's totally sunken in, almost like a peanut head, where her temples are. And this is a safe area. It is off-label, meaning it's not FDA approved to place filler there. However, with appropriate training, it's a very safe treatment. It can take more than one round of injections to really elevate that temple. But basically, we put one little stick up at the top of that depression, make sure there's no blood vessel nearby, and do a slow lifting injection under the muscle. When you bite your jaw together, you can feel the muscle contract. So actually lifting the muscle so that filler doesn't show. It's a very smooth fill. And it makes a really big difference because giving smoothness here adds wideness to the face where we tend to lose volume as we age. So it helps the face have more proportion across the upper eye, forehead area. So it's a beautiful treatment. And it's all about keeping the patient's filler in proportion.
Mm-hmm. Hope, any thoughts?
Agreed. I love the temples. I do typically, like Karen does, do them in a step process. So we'll do some volume, have you come back, look at it. Maybe one side was deeper than the other. We'll add some more until we get a smooth transition. And it makes a big difference. Like Karen said, no one comes in. I've never heard it before. Hey, I've got this. Let's put some filler there. I'm always the one to bring it up. And once we do that, the patient, I mean, it's a big difference and it's subtle. No one ever notices, oh, you know, you had temple filler. It just makes a big difference in the contour of the facial structures. So
yeah, it's actually fun to do as well because I'll have them feel the area and they can feel the depression. And then you lift one side out a bit and then they can feel the difference. So that's kind of fun because most of the time with filler, they're not feeling a difference. They're seeing it. And this one, they're actually feeling that correction. Oh, and so I picked this picture of Lindsay Lohan. This is definitely what they're calling the pillow face. Mm-hmm. You know, she's got beautiful cheeks, a beautiful smile. And of course, the blonde picture, she's more aged, but she's got just too much filler. Her eyes are smaller when she smiles. She can barely smile. She can barely close her mouth. Both her upper and lower lip have been augmented so much. And I'm not sure why this is a thing, but we see it.
Older.
Yeah, you know, they're trying to just fill up volume in their face, but it just doesn't always work. It's too much.
She has kind of that closed eye going on too that Dr. Mednelsohn was talking about.
Yeah,
she's not even animating really. She's not really smiling. So that would probably get even worse if she smiled. Mm-hmm. So I would definitely reduce the amount of filler underneath her eye, focus it more on the outer cheekbone and have the lips a little bit softer.
Yeah, and if you look at the amount of fill, if you look kind of just outside of where her nose, under her eye, in this area, it's actually puffy in an unnatural way there. So, I don't know. She thought more of an apple was a better idea, but I would disagree.
Yeah, you know, I just want to make a comment about that because you were kind of, I mean, obviously we're trying to educate and go through some of the common things that we see. And I think it's important also to recognize that we need to sometimes help guide patients. They may see things that I don't want to say don't really exist, but you know, we'll take Michael Jackson for an example with his nose, you know, with body dysmorphic disorder. And I think we want to be aware that besides the technical, artistic, medical side of what these guys are doing, you know, day in and day out, there's a real psychology with this. It ought to be a positive thing. Everybody's probably feeling right now with this whole stay with the coronavirus and, you know, oh my God, you know, everybody feels tired and looks tired and so everybody wants to be refreshed. That's one thing. But sometimes when we focus so much on just one narrow area, we kind of lose sight. So I'll have patients sometimes literally kind of take a step back and just look at the whole picture. Look at their face overall, instead of being so nitpicky on some things, because I think what we see sometimes is we focus on it, we can't fix it, and we keep filling, we keep doing whatever, and the next thing you know, you end up in this situation that just is completely unnatural. Patient's not satisfied anyway. It's not that we did anything right or wrong. It's that it just is the wrong individual to, you know, to be undergoing these sorts of treatments. So I just want to mention that. I think maybe I'm mentioning that for that photo because I don't know, the photo itself just looks a little depressing to me, and so that's the sort of look. She doesn't look happier, right? I mean, I realize it's a photo, but she doesn't look happier in that photo with the change that was made, and so you have to assume that there were some things that that are going on. But I'm not suggesting that Lindsay Lohan had anything going on. All right, let's move to. But look at the difference. She looks happy, and she just doesn't look right there. All right, next. All right.
All right, I chose this photo for similar reasons. This is someone, to me, who has the classic duck mouth look, and all of her lower face and her mid-lower cheeks are very full, yet, in my opinion, the contour of her cheek here, where the prominence is lower than it should be. She's got everything filled here, and she should have had some volume placed more on her outer cheek and perhaps just a little bit higher up under her eyes. But her lips are so full. I'm not sure what she looked like beforehand, but this to me does not look natural. It looks like a duck lip. She's paying all of her attention to the lower lips and cheek and not paying attention to the outer cheek and a little bit perhaps under the under eye area. So it's not horrible. You wouldn't look at her and, you know, stare and think she looks horrible, but it's still just, it's not quite right. And my guess is that her lips are quite a bit fuller than they started.
Yeah.
What do you think, Hope?
Yeah, I agree. So mainly as injectors, when we treat the mid-face, this area here, it's in general to create a more lifted appearance. And, you know, there's so many other ways we can do that without just accumulating fillers here. You know, everybody hates the jowls that start to form. We can go on the outer jawline. We can go on the, like right on top of the bone around the jawline. It doesn't make you look like you have a bigger jaw or a bigger face or anything like that. It just is another method to help pull back away from those jowls instead of gathering everything, you know, right up here, which just doesn't give a natural appearance. And sometimes, you know, my patients or whoever will say, well, I hate this fold. And I'm like, well, you want some fold, you want some sign of aging, you want to, you know, have something there. So we're never going to overfill to the point where you don't look natural.
Okay. All right. Well, we've got a couple more left here, so let's take a peek. And there you go.
Again, that pillow face look. Her cheeks are too full. Her eyes, even though she's not really smiling, her eyes are smaller. She really has pronounced filler volume to the sides of each of her nose. Her lips have been filled to the point that this very pretty curve at the corner and her Cupid's bow, and her lips were beautiful. Why would you distort that? And my guess is that she has, you know, volume loss with aging, but you can restore volume without distortion. We use Volbella. It's a very soft filler. You can start with a half a syringe, which is 1/8 of a teaspoon. It acts as a smooth glosser to the lips without making them larger. And yeah, this is clearly an example of more is not better. It just, she just looks, she looks mean. I'm also wondering if her Botox has dropped her mid-brow.
Yeah, that's what I see too. Mm-hmm.
Because you know, it just, if you look at where her eye sits and then the middle of her brow, it looks lower, as if she's had too much Botox placed there.
Yeah, she looks unapproachable. You know, she does. She looks a little bit like she's scowling. because that forehead Botox, like we were talking about earlier, it's making her brow sit a little heavier. It's making this look flatter, the glabella, the area in between the brow, look flatter. So it makes her look like she's scowling a bit.
Mm-hmm. Yeah, she, I don't even know when this photo was from, but do you know, Karen? Or
I don't know. I don't know.
I remember her back in the day with, what was that? Was that Dudley Moore? What was that show? That movie?
I remember her from Splash.
Splash, maybe that was it.
That was one. Yeah, I know where she at. Yeah.
All right, let's go to the next one, the last one.
Courtney Cox, I love her. She's so beautiful. She's talked openly about her filler experiences. I don't know if you guys have ever seen that, but she's talked about that she's had too much and she has allowed it to fade off. So I'm not sure when this photo is from, but I chose it because you can see that some filler was placed medial or before the under eye in this area. And that projection right there, you can even see the light is casting off of it. So that's not where you want light to cast off of your face. That's kind of a big thing that I look for, and I'm sure Karen does when we're doing filler. You want light to bounce off of certain areas. That's what we end up not liking about our face, really, are shadows that are created as we age and we get these folds. But so you want that light to cast outward, further outward. So her volume should have been placed more laterally or outward on the face. The other thing is that they maybe forgot to put a little bit of filler in the under eye area, maybe just a little bit in that center portion. Might have helped it look more transitional or more uniform. Her lips look okay.
Yeah, and I guess beauty's in the eye of the beholder, as they say. So everybody has a preference, and I think, I think overall, I think you guys, all of us, we really try to take that into account. It's not that they are our aesthetics. It's what looks appropriate. There are some guidelines that we use, but anyway. So what do we call this? The big, the bad, and the ugly. What did you call it? The good, the bad.
Good, the bad, and the ugly.
Anyway, I don't know if there was ugly. I think there was some bad there, though. But anyway, well, any other comments, ladies?
Nope. That's it.
Okay. All right. We'll be back tomorrow. Thank you all. And please, if you have any comments or feedback, I think that we are going to start doing some other fun things. So we will we'll keep that in mind. In the meantime, have a wonderful day, and we will see you back tomorrow. Thank you.